Hello Pharma friends, welcome to Pharma Syndrome YouTube channel. In this video, I am discussing anti-cancer drugs in easy way. As you know, cancer is nothing but a uncontrolled cell division as well as a uncontrolled proliferation. So cell division is simply from 1 to 2, 2 to 4, 4 to 8 like that. But in this case, it is proliferation, uncontrollable cell division. And especially as you know, the cancer cells escape the G0 phase of normal cell division, but generally in G0 phase, nothing but quiescent phase, there is a no cell division, but cancer cells will continue divide. Because of that, cancer cell growth rapidly will occur, and that leads to different types of cancers. And here our main focus on the anti-cancer drugs. And these drugs are in different mechanisms. These are used to reduce or control the cancer cell growth. So here there are a lot of categories are there. In that category, first I am discussing the alkylating agents. The name itself indicating these drugs causes alkylation of the essential bases in the DNA and causes intercalation of the DNA, breakdown of the DNA strands, and these alkylating agents are also called as radiomimetic agents. So in this category, the mnemonic is partner. So P means platinum compounds, that is mnemonic like COC, cisplatin, oxaliplatin, carboplatin. So the name itself indicating these are having the platinum in their structures. Next is alkyl sulfonate. The example is the busulfan. And next is the triazines with the mnemonic TDP like temozolomide, dacarbazine as well as procarbazine. And next is the nitrogen mustards. The mnemonic is CMCM, cyclophosphamide, chlorambucil, melphalan, meclorethamine. So the major drawback of cyclophosphamide is it produces a dangerous side effect, hemorrhagic cystitis, that can be controlled by using antidote, mesna. And next, nitrosoureas. The examples of nitrosoureas with trick like carmustine, lomustine, estramustine, bendamustine, streptozocin. The trick is collapse. And aziridine is the last compound in the alkylating agent, nothing but last category. The example is the thiotepa. The example is the thiotepa. So all these alkylating agents are causing intercalation of the DNA strands and breakdown of the DNA strands in the cancer cells and suppress the cancer cell growth. And next is the anti-metabolites. So the anti-metabolites name itself indicating they affect the metabolic process in the DNA cells by preventing folic acid production, by preventing the essential bases of the DNA like purines as well as pyrimidines. And here the here the folic acid antagonist like mnemonic ramp. R means raltitrexate, A aminoterin, M methotrexate, P pemetrexate. These are the folic acid antagonists. As you know, folic acid is essential for the DNA synthesis. Okay. And next is the purine antagonist. Examples like fludarabine, nelarabine, fludarabine, 6-mercaptopurine, as well as 6-thioguanine. These compounds oppose the metabolism of purine or synthesis of purines in the cancer cell. And next is the pyrimidine antagonist. Examples like gemcitabine, capecitabine, decitabine, citarabine, 5-fluorouracil, fluoxuridine, as well as azacitidine. These drugs oppose the pyrimidine synthesis in the DNA, cancer DNA, nothing but DNA present in the cancer cells. So that is about anti-metabolites. And next category is the plant product. As you know, in the treatment of cancer, there is a plant products and the mnemonic is VTech. V means vinca alkalides like vincristin, vinblastin. Vinca alkalides affect the metaphase in the cancer cell division. And taxanes, even taxanes also affect the metaphase in the cancer cells. Examples like paclitaxel, docetaxel. Next, epipodophylotoxins. Epipodophylotoxins like etiposide as well as teniposide. Next, camptothecin. Camptothecin example like topotecan as well as irinotecan. Tecans are camptothecins. Poside nothing but epipodophylotoxins. Taxel nothing but taxanes. And vincristine means vincristine as well as vinblastine. And camptothecin inhibit the topoisomerase 1 in the DNA synthesis. And epipodophylotoxins inhibit topoisomerase 2 enzyme. And next is the anti-tumor antibiotics like penicillins as well as cephalosporins. They will derived naturally from the bacterial source. Like here also, some of the antibiotics naturally from the bacterium they used in the treatment of cancer. That is first chemically chromomycins. So like dactinomycin as well as actinomycin. And next is anthracyclines with the trick ADD. So A means anthracycline, D means doxorubicin, E means epirubicin, D means danorubicin, I means idarubicin. And other category of antibiotics like bleomycin as well as mitomycin. Bleomycin generally called as a copper chelate, complex of copper chelate. And next is the tyrosine kinase enzyme inhibitor. So as you know, tyrosine kinase is one of the major enzyme responsible for the expression of cells, nothing but in the form of cell division, cell growth. But excess or over expression or over presence of tyrosine kinase enzyme in the cancer cell will multiply the cancer cell growth. That's why we have to inhibit the tyrosine kinase enzyme. And tyrosine kinase enzymes are simply TNIPs and with a trick like deglin, like dasatinib, lapatinib, erlotinib, imatinib, zefitinib, as well as nilotinib. All these NIPs are with a trick deglin and inhibit the enzyme tyrosine kinase. So tyrosine kinase is one of the important enzyme or essential enzyme which can multiply the cancer cells easily and develop the cancer. And RAF kinase inhibitor. So RAF kinase inhibitor is the sorafenib. So this is simply regarding the anti-cancer drugs along with this classification with easy tricks and mnemonics. So this is anti-cancer drugs part 1 only. For part 2, you can see in the next video. Thank you so much for your watching. So please subscribe to our channel and share to your friends for interesting information along with crazy info. Thank you and all the best.